Hi, my name is Sarah Winward, and I am a naturopathic intern at the Barefoot Health Naturopathic Clinic, and I'm here today to talk to you about do-it-yourself PAPs. So just to start off, I'm just going to tell you a little bit about what are PAPs and why they're important. So a PAP test is a test that involves taking a sample from the cervix to test for the health of the cervical tissue, and traditionally they involve using a gynecological exam, so with a speculum inserted into the vaginal canal to take the culture. And the reason why they are important is because they are used to screen for the health of the cervix, and that's really important in the early detection of cervical cancer. So Health Canada actually recommends that women are screened starting at the age of 21 or earlier if they are sexually active. And that screening is repeated every 3 years up until the age of 70. So that's a lot of screening. At Barefoot Health, we are super excited to be offering do-it-yourself PAPs. With that, we are able to test for, with the same swab, the health of the cervical cells, the strains of HPV that are present, if there are any present. And HPV is the virus that causes both cervical cancer as well as genital warts. It's also going to test for chlamydia and gonorrhea. And this is really amazing because you can actually do the test yourself in the privacy of either the bathroom or the clinic room, and yeah, you can just do it on your own. So basically what will happen is that we will let you know what the results are, and then if anything comes back abnormal, we can do a follow-up assessment and then refer you as needed. So now I'm going to talk a little bit about how to do the do-it-yourself PAP, but before we do that, I just want to talk a little bit about some female anatomy. So this is my not particularly artistic drawing of the vaginal canal and the cervix and the uterus. So this is the vaginal canal, and you can see that the cervix comes and dips down into the vaginal canal, and on either side you have what are called the lateral fornices. So when you're taking the sample, you want to be taking the sample from this area where the cervix is, and not in the lateral fornices. So how do you do that? So the best way to start is to get a little bit familiar with your own anatomy. So I would recommend washing your hands and just inserting a finger into the vaginal canal and seeing if you can feel your own cervix. It will feel either like the tip of a nose or like lips, depending on where you are in your menstrual cycle. But it should feel firm, and it should feel different than the rest of the tissue. Also, depending on where you are in your menstrual cycle, it might be further back or up, so it might be a little bit harder to reach. It can be really helpful to sit down on a toilet or to kind of squat, and that helps sort of bring it closer to the opening of the vagina. Okay, so once you've done that and you have an idea of where you're taking the sample from, you're going to wash your hands and then open the sample container. So the sample container looks like this. It's got a little plastic covering on it. And you just open it and leave the cap off. There's a liquid in it, so put it down on a flat surface. Next, you're going to take the brush. The brush looks like this. This is the part that you ideally want in the opening of the cervix, which is this part here, to take the sample. So the best way to do this really is to use your finger as a guide. So you can sort of put your finger up close to it, and then you might want to open your labia with your other hand so that you're not accidentally hitting them with the brush, because that's kind of uncomfortable. And then just slowly insert it into the vaginal canal. And you should feel some resistance when you hit the cervix, and it'll feel a little bit uncomfortable and kind of weird. So you're probably going to insert this about halfway, sometimes a little bit more, sometimes a little bit less, depending on the shape of your vaginal canal and depending on where you are in your cycle. Once you hit the cervix, you're going to want to rotate the brush 10 times in the same direction. So using your other hand, just rotate the brush 10 times, and then you can just remove it. And then once you remove it, you're going to put the brush into the sample container, and basically you want to get the cells off of the brush by sort of mashing the brush on the bottom of the sample container so that the bristles spread apart. And you want to do that at least 10 times, and then give it a bit of a twist as well, getting all of the samples as much as possible off the bristles. And then you can just dispose of that in the garbage, close the sample container, and return it to reception. And you are done. So that is all I have for you today about do-it-yourself PAPs. I hope it was informative, and if you are interested, you can book an appointment at Barefoot Health.